to the responsibility to protect.
On atrocity prevention.
Words kill.
All societies are potentially vulnerable.
Atrocity crimes.
Timely and appropriate action.
Welcome to Expert Voices on Atrocity Prevention by the Global Center for the Responsibility to Protect. I'm Jacqueline Streitfeld Hall, Research Director at the Global Center. This podcast features one-on-one conversations with practitioners from the fields of human rights, conflict prevention, and atrocity prevention. These conversations will give us a glimpse of the personal and professional side of how practitioners approach human rights protection and atrocity prevention, allowing us to explore challenges, identify best practices, and share lessons learned on how we can protect populations more effectively. Today I'm joined by Niemat Ahmadi, the founder and president of Darfur Women Action Group, a women-led anti-atrocities organization that amplifies the voices of those most impacted by the ongoing violence in Sudan. Thank you for joining us today, Niemat.
It's my pleasure, and thank you for the opportunity.
Niemat, can you share a bit about how you personally became involved in human rights advocacy in Sudan and about your current work with the Darfur Women Action Group?
My activism started earlier when I think it was in middle school. I have this tendency of like when seeing something, I want to do something about it. And back then, I don't know what that means, but I just jump into action. And then by the time I was going to college, I volunteered for a nonprofit organization that in our hometown, mostly like work in the rural area of my hometown, founded by local people from about 16 village council to serve their community, and that was supported by Oxfam Great Britain. So that kind of introduced me to NGO world, and I really like what they were doing. So I started volunteering, and I ended up working for Oxfam. Briefly, Oxfam Great Britain, an emergency relief before I go to college, and that kind of opened my eyes to the issues and problems that are affecting our community and what we have to do about it. So by the time I was in college, I was already ahead of my peers in terms of like knowing what is going on in our society, and also being going to Khartoum from Darfur. You see the disparity in the development in everything, and also the way that people from remote or regions that are inhabited by indigenous African in Sudan, like Darfur, South Kordofan, South Sudan, back then before it is separation. There was a clear like disparities in everything, and that kind of motivated me in a good way that there is something for me to do, and that informed even what I was going to study and how I'm going to involve. And after I graduated, my plan was very clear that I will go home to Darfur and will start working around to help our community and help my family for about 3 to 4 years, and then my plan is to come back and do my master's. And I had this plan that I will create my consulting company, try to help government and NGOs to have realistic but also effective development policy in the country. So that was the plan. Unfortunately, after my graduation, I started working for international NGOs, and we had the opportunity to go around help people, providing development assistance and training village committees to uh, create their own organizations, and helping women who are working on women empowerment projects, education, all of that. And I was so excited and felt motivated to by the impact I see that we make in our community. But all of a sudden, that was stopped in one day when the genocidal attack in Darfur started. And that is the time when the biggest shock of my life happened. But then, still that tendency of jumping into action, even though it was not safe, but I wanted to do something about it. So our organization sees it as operation, but we, as a group of women, organize and immediately start going out because at that moment, people were attacked in the rural area, and they flee and come to my hometown. And given the fact that the first areas to be attacked was the areas surrounding my hometown, the remote villages and suburbans of that area, people were fleeing, coming to the town, and then the government soldier and the Janjaweed will push them back. So we started immediately organizing to help these communities. So that is how I started.
Within the current context of the conflict ongoing in Sudan today, can you give an overview of the situation in Darfur?
Unfortunately, I'm very saddened to come after 20 years of the first genocide in the 21st century to speak about another mass atrocities and genocide in Darfur. As you know, the April 15th war started in Khartoum and Marawi, this vicious cycle of violence that started as a form of power struggle between these two generals quickly spread to across the Sudan, and Darfur has been the most impacted because for the fact that you see clear confrontation between the rapid support forces and the Sudan armed forces in places like Khartoum and other regions. But when it comes to Darfur, it is a systemic attack against a specific group of people by the rapid support forces. In most cases, they were not Sudan armed forces, but the rapid support forces, instead of them claiming to be fighting against the Sudan armed forces, unfortunately, they are systematically targeting people. So today, the entire Darfur is being controlled by the rapid support forces. And just to explain to you what the situation looked like as of now, that the rapid support forces, when they come into the city, they first make sure that they destroy, loot all the food storage, the markets, including pharmacies, and they burn the remaining. They loot people's properties, loot vehicles, so that people trying to flee are unable to flee because they don't have means to flee. And by doing so, they actively eliminate all the survival means for people. And that is why millions of people are trapped right now in Darfur, with exception of people from West Darfur who were forced after the massacre and ethnic cleansing that took place in Al Junaina. They were forced to flee in mass border crossing of civilians that have not been seen in recent history, mostly killing men and young people, raping women systematically, and telling women in some instance that you should be happy that now you will have an Arab child. In Al Junaina, when they massacre people and killed the governor, they said, now we have liberated Al Junaina or West Darfur from the Abid, which is the word slave in Arabic. And they said it is no longer called Dar Masali. It is now Dar Arab. Dar, which is the homeland of Masalit, now will be the homeland of Arabs. So you see the intent and the systemic intention of removing, killing these people, exterminating them, but also uprooting them from their land and replacing them with Arabs groups. And that, I thought it should have shocked the world conscious and prompted them to act, unfortunately continued. And after that, they go city after city, village after village, targeting mostly cities and areas that inhabited by the indigenous African tribes of Masalit, for Zagawa, and unfortunately, these are the same group that were targeted 20 years ago for the therefore genocide that started in early 2000, 2002, 2003. And now the entire Darfur is being controlled by the Rapid Support Forces, with exception of Al Fashir. It is the capital city of North Darfur State, but also is a historical capital of Darfur region, with systemic attack continued to be perpetrated every day for the last 4 months. It's Al Fashir house about 2 million people, most of whom are the most vulnerable groups, internally displaced people from 20 years ago who remain in camps. There is this the largest two camps in Darfur, Abu Shok camp and Zamzam camp. And this has not just limited to the outskirts of Al Fashir, but before the large scale attack in Al Fashir, they have the Rapid Support Forces have burned about 40 villages from the area surrounding Al Fashir, with intent to eliminate all food and goods coming to Al Fashir, as in preparation to isolate the people in Al Fashir from any supplies, and after which they start attacking the city. Recently, they also systemically targeted 4 hospitals in Al Fashir, the only remaining hospital that many people were transferred to receive treatment, including those who have wounded. Um, and then women facing emergency cases, children with severe or acute malnutrition, were in those hospitals. They bomb the hospital while patients are inside the hospital. Most of the Al Fashir citizens, they move into Zamzam camp right now. Many have been trapped in their homes, while the Rapid Support Forces is targeting uh, civilians. Also, the Sudan Armed Forces using airstrike, randomly bombing, mostly hit civilian residents, public services, including electric service, water sources, markets, and other public services like schools and hospitals. So today, people in Al Fashir don't have many options. Unfortunately, they either remain and die by bullets or air bombardment, or flee, and they have nowhere to go because Al Fashir has no neighboring countries, has no nearby any borders that they can cross. The closest place is Libya, which is miles and miles away in a desert. Many people who attempted to flee died in the desert in Libya. A few were able to make it. So the situation in Darfur right now, it's the worst humanitarian and civilian protection crisis that we have not seen in our lifetime, and I don't think we will see in any place. The hunger has been already declared, famine has been declared, and back in February of this year, MSF, or Doctor Without Border, stated that a child dies every 2 hours. That threshold has been surpassed now, and people who fled Al Fashir have not received any humanitarian aid, because the last humanitarian who remained in Al Fashir, they were forced to flee after the intensive attack recently. So the situation in Darfur right now, I think if nothing is being done, we will see the highest mass deaths of civilians that is unprecedented. We have been calling and talking to the international community, but things seems to me very slow. But also the warring parties are adamant to continue fighting without regard to civilian life. But in Darfur, our civilians are the one who are bearing the brunt of all the attacks.
Yeah, it really stands out the way you said that what's happening now is unprecedented number of deaths and a level of harm not seen in your lifetime, given, the comparison to what happened in Darfur 20 years ago. It just shows how stark the current situation is. I know you've mentioned the attack on the hospital that was treating women and children and instances of sexual violence, but what are the specific risks or, unique impacts of the current situation on women and girls in particular?
Well, unfortunately, in this recent war in Sudan, sexual and gender-based violence become the defining feature of this war. From day one, women were targeted for abduction, all forms of sexual violence, including sexual slavery, forced marriages, and many women have been abducted. Until today, nobody knows their whereabouts. Families were silent by the fear of retaliation. And in Darfur today, the more we see the attack, the more incidents of sexual and gender based violence that are reported, and we see from those who are on the ground and eyewitnesses report that every day you see attack escalated. That means escalated attacks on women and escalated cases of sexual and gender based violence. The youngest victim has been a 7-year-old child, and women of all ages have been systematically targeted in a way that is unprecedented, unfortunately, and it is increasing. And what is really hard is that there is no um, access to services or treatment for women, or either trauma counseling or psychosocial support. People are on the run constantly, so families are left with very limited options. Sometimes they have survivors who are in dire need of health assistance, but there's no place nearby that you can reach. And in order to take survivors to far away places, it takes a lot. And families have to make those choices between helping their entire family survive with the little that left for them, or help transport the survivors to receive medical attention. And in most cases, that is not even an option in Darfur. In many areas, going a few hospitals that remain functioning are fully controlled by the rapid support forces, like in Niala, in Zalingi, and in Al Junaina. Victims and survivors, their families, they cannot go to these hospitals because these are hospitals that are fully controlled by the attackers. MSF tried really hard to provide medical supply, to set up their hospitals or clinics to help the people. The rapid support forces systemically restricted the medical supply coming into the area. The insecurity have forced them out. So women are left with no option. And in all our conversation with those who are working on the ground, with survivors that we talk to, and families, that sexual and reproductive health has been the biggest gap, because also even in Khartoum and in other places, in the areas in eastern Sudan and northern Sudan where there is relatively safe and stable areas, that many specialized doctors have left the country, because in the early days in the attack, there was systemic targeting of medical personnel, and also abduction of doctors sometimes because of the rapid support forces wanted to take them away so they can take them to remote areas to treat their wounded soldiers. So the situation for women is really um, dire as of now.
Can you tell a little bit about the work that your organization is currently doing amidst the situation in Darfur?
Well, our organization has been faced with unprecedented challenges because before the war, we were running about 5 projects, and most of these projects were capacity building, movement building, organizing, and we only had one project that is GBB prevention with access to justice, and then documentation of human rights violation. When the war started, all those projects were suspended because most of those projects were meant for the interim period during the transition, and we were hoping for a transition. When the war started, all the internationals have left the country, including international humanitarian agencies, and our people left with nobody but themselves. And we immediately jumped into action, even though we did not have enough resources. We haven't done humanitarian before because our organization has very small, limited capacity. But we jumped into action because there was this huge gap. We immediately started fundraising with the diaspora communities, individual donors, and immediately set up volunteer groups everywhere that there is a need. And until today, we have volunteers and teams in Zamzam camp that are providing assistance to those in need, in addition to documenting human rights violations and documentation of GBV. We also set up safe spaces called Women Empowering Women Centers as safe space for survivors to receive treatment and counseling, and also to be away in a safe place where they can heal. In those areas are all run by local focal points and volunteers who are trained even before the war started, because the way we use is to train people from within the community so that in the event that international NGOs or those who are coming from outside and unable to operate, that we still have people who are trained in the community to be able to render services and help for their community. And that is what have helped our organization to stay the course and be able to provide support for our community. We also are documenting GBV cases. We also help with protection for human rights defender, mostly women human rights defenders, and then also relocation of survivors. In addition to our international advocacy, we have done hundreds of briefing since the start of war to members of the international community, including UN Security Council. We did advocacy around Human Rights Council. Uh, we collaborated with the fact-finding mission, the panel of experts, trying to make sure that these agencies are able to reach those who can inform their reporting. And we also have been doing advocacy around accountability. We have been the first to prompt the prosecutor's office about the the pattern of the attack in Al Junaina in West Darfur, that it exhibit the systemic attack that we have witnessed in 2003, but this even worse. And we urge them to look into that. And luckily, the prosecutor Karim Khan was able to extend the jurisdiction of the ICC to the current crimes. We also have been briefing the US government officials that are working on Sudan, also briefing USAID, their Sudan's team, people that are working on humanitarian, every now and then briefing international NGOs working on Sudan, and speaking to IGAD, African Union, organizing. DUAC has mainly been organizing civil society groups and making sure that this policymaker hear from them, especially women, civil society, diaspora, civil society, and also human rights defenders. Some of those who fled the country and living in the neighboring country right now, but they are fully informed. They know what is going on, and they can better inform the policymakers. We have been also advocating for delivery, urgent delivery of humanitarian aid, as well as calling for authorization of forces to protect civilians. And I'm just coming back from New York for almost 3 days, busy week in New York. Also spoke at the commemoration of the mandate of the Secretary General's representative on sexual violence in conflict zone, and as well as also have private meetings with several member states who are working on options currently for uh, delivery of humanitarian aid to Sudan, as well as also seeking advice for civilian protection options and needs on the ground, and what else that needed to be done. So we, despite the size of our organization, limitation of resources, we have been all over the place because of the dire situation, but also the need, especially in the early days when the war started and there are not many people. All those in Sudan were cut off, especially cutting the communication services has been worse than cutting food and water, because people were let to die simply because they are unable to make that call. So at that time, we move aggressively to reach everyone who may do something to help with regard to the situation in Sudan and Darfur. And in the early days, the media was focused heavily in Khartoum, but there wasn't attention on Darfur and other remote areas like South Kordofan. So we also made sure that we draw attention to these areas, that we speak to policymakers, that we speak to media and others. And we also organize people, people in the diaspora are so traumatized, because the entire country is being in this crisis situation, and every single person have lost a family member, or have a family member trapped somewhere that they need to get them from A to Z. So people are so overwhelmed, traumatized. We also wanted to make sure that we continue to coordinate and organize our community, encourage them to do something, and that encourage them to collectively work to do something, to especially advocating and exercising pressure on the international community. So we have been also participating in several other groups, like the advocacy groups that are doing advocacy on Sudan, on with our international partners doing advocacy around um, international forums like Human Rights Council and others, to ensure that we influence, including advocating for the renewal of the mandate of the fact-finding mission, continuation of the panel of the expert. Also, have been calling for accountability, extension of jurisdiction of the ICC to entire Sudan, expansion of the arm embargo to cover Sudan, but also enforcing the existing one. So we have been doing a lot actually, and we are doing things that we have not done before as an organization. But when it comes to the need of the people on the ground, we want it. I know it is not enough, but we want it at the least to keep the hope that our people are not forgotten, that they know that we are here for them, that we do our best. We may not be able to respond to their need, but that we have not abandoned them. And um, that is what we are trying to do. We also have present in Uganda. We brought some of our Khartoum team to Uganda. Currently, are working to support our Sudan team. We also have established presence in South Sudan, and we are on the process to register to operate in Chad. And we, as an organization, we wanted to be where our people are because of the need. Even those who fled to Chad are still facing lots of challenges. Their humanitarian and emergency need have yet to be met, and we wanted to be there to help inform the service provider, humanitarian aid, and also policymaker, including where to put the funding, as well as being there to help those who fled. There's a large number of civil society groups who fled with their families from West Darfur or from across the Sudan, but they are now living as refugees in exile. We want to put them to work, to provide an umbrella for them so that they can be able to render services as they used to do back in Sudan.
I really appreciate how you started that by talking about how, you did a lot of work in capacity building and then had to pivot. And I think it really highlights the wide spread effects of an atrocity situation. It's about more than just, attacks on civilians and the devastation that leaves in its wake. It's also all progress on capacity building gets halted and in many cases goes backwards because you can't continue your program. So, it's an important thing to keep in mind in these situations. So I appreciate that you mentioned that. Given that you've been doing so much advocacy at the multilateral level as well as with different governments and the regional organizations, what are the immediate steps you think must be taken to prevent further atrocities in Sudan? And what is the long term outlook for peace and stability?
The most pressing, urgent need and the steps that need to be taken right now is urgently deliver the desperately needed humanitarian aid because it's really sad to see that the international community, including the United States, are looking to get the warring party to stop before they can deliver humanitarian aid. And I believe humanitarian aid should not be wait until the war stop. It is the same way that we deliver humanitarian aid in Ukraine while the war is still ongoing, because sometimes you can't control those who wage war, but you can at least control your decision to help those in need. And that is not the case in Sudan. They're trying to bring parties together, trying to get ceasefire, and these are the people who created the suffering in the first place. They are the one who are perpetrating these crimes, and they're the one who are putting these people in these dire conditions. So you don't expect much of them. And what we need to see is that humanitarian aid be delivered, cross-border, airdrop, all options that are available. We even identified route for humanitarian aid delivery, like Tina crossing from Chad to West, North, and Central Darfur can be used. Border of South Sudan to South Kordofan and Nuba Mountains. Al Fashir Airport is away from the fighting, and it can be used by the UN planes to drop food for those in need. And there are many options that can be used. Number two, we are also urgently calling for civilian protection, and we urge the UN to authorize forces that will protect civilians at the least some areas with large number of displaced and camp, like Al Fashir, with two of the largest displacement camps and the most vulnerable groups that are currently dying in silence. Niala, where there is the largest camp in South Darfur, Kalma camp, Al Junaina, where ethnic cleansing have been brutally perpetrated, at least enabling these people to create a demilitarized zone with international regional forces that can not just protect civilians, but also enable the humanitarian actors and agencies to work safely on the ground so that they can be able to reach those in need. And also accountability. I think these two steps will create an enabling environment for investigation to take place, to document these atrocities and establish records so that we can pursue accountability. And I do believe that the current crisis in Sudan is the cost of immunity for crimes committed in Darfur, including genocide, war crimes, and crimes against humanity that was perpetrated 20 years ago. Most of those indicted are yet to be brought to justice, and I believe the generals were thinking if it worked for Bashir, then it worked for us. If we can keep our weapon, keep the power, kill everybody, and we can get away with immunity. And that is what they have been doing literally. And that's why accountability is very important. So then these three steps will set the stage for future peace. And when we say peace, I think it has been a norm in Sudan that international community, including the United States, they come when it comes to resolving the crisis. And we have seen this with the situation in Darfur, South Kordofan, and the Blue Nile. They could only negotiate with a handful individual, those with gun, with power, and maybe a few of traditional political parties, people who have reinforced the policies of the dictator and the regime that is destroying the Sudan. And people like civil society groups, lawyers, women, civil society leaders, and human rights defender, youth are not invited to the table. And when the solutions are made, so we are repeating the same scenario of having those who created the problem in the first place controlling the destiny of the people of Sudan again and again. And we have seen that in the interim period, the very sad situation of a missed opportunity that were there in 2019 when youth, women, and civil society group were able to force a 30 years of dictator out. But then we had the military jumped in again and they were allowed to control everything. And here we are facing what we are fearing back then. So I think to establish a sustainable and lasting peace is that the two warring parties must not be allowed to be a part of any political process in the future to determine the future of Sudan. There is a need for a civilian government, and we are a group. When I say we, it is a coalition of Darfuri civil society organization with others from historically marginalized, conflict affected areas. We have developed um, an approach that calling for in the interim period to have a multi-regional interim government that is not affiliated with political parties, it's not affiliated with the military groups, but at least selecting people or giving people to select their representation from various regions of Sudan and also bring their vision for the future of Sudan so that we can combine the priorities of the people of Darfur with the priorities of the people of the East and the North and the center to have the priorities of the people of Sudan. Then that will inform the process of setting up the interim period while working toward transforming the country to the future of stability and lasting peace.
In light of the unique abuses faced by women and youth in Sudan, as well as the immense role they've played in supporting their communities physically as well as, socially over the past year and a half, how important is it for women and youth to have a role in any political process going forward?
Well, I think women, the Sudanese women they have important role to play, and this supposed to be informed by what women are doing right now and what they have done over the last 30 years of al-Bashir ruling, of the years of the long-standing crisis in Darfur. Despite being victims of the most brutal attack on them, women have demonstrated outstanding resilience and courage to stand up for themselves, their communities. And in the recent war, when the international community fled the Sudan, it felt gloomy and it felt like the end of the world for the people of Sudan. But women have stepped up with youth and volunteer groups. They immediately started and they serving as frontline humanitarian workers, feeding the hungry, documenting atrocities, providing medicine for those facing chronic diseases, identifying safe route for people fleeing to safety, and at the same time keeping the international community informed. And when it comes to negotiation, the women's voices are mostly sidelined or silenced. And this time around, I think we must prioritize women's participation from the start, whether it is we as Therefore Women Action Group and our network, large network of civil society, we're calling for women participation to be from the start, whether it is de-escalation of violence, achieving ceasefire, or negotiating political settlement, including also decision on humanitarian aid distribution. Women must be included and participating in all level of decision making. And I think participation of women is not a value added, but it is a right and essential. And I do believe that Sudanese women will change the face of Sudan. And it is a great investment that we invest in those qualities. And we must exercise pressure on those who are working to resolve the crisis in Sudan, that without women participation, Sudan will not be in peace. So any solution to Sudan will not be made because of the role that women have been playing and the advantage that we can achieve with having women on the table, and for the fact that no woman in Sudan have perpetrated war crimes or crimes against humanity or rape or conducted a coup. Women have been, when these generals are raging war, women are serving the community, they are making peace, they are organizing, they are documenting, and they are speaking to the international community. They're seeking solutions. And I think that is a place to put our investment in it. And this time around, we're not going to be nice to those who are making solution to invite women to the table as a value added, but to include and integrate women's voices, women's agenda. And we are working really actively with women groups to develop unified women agenda so that they can proactively involve in every aspect of resolving the crisis in Sudan and establishing sustainable peace, including also women inclusion in the accountability processes. And we do bring women to advocate around the ICC, but also for future accountability, that women must be included in the accountability processes, not as victims and witnesses as usually do, but as advocate and policy shapers of the court and any of the future accountability processes.
Thank you for joining us for this episode of Expert Voices on Atrocity Prevention. If you enjoyed this episode, we encourage you to subscribe to the podcast on Apple Podcasts, SoundCloud, or Spotify, and would be grateful if you left us a review. For more information on the Global Center's work on R2P, mass atrocity prevention, and populations at risk of mass atrocities, visit our website at www.global2p.org. and connect with us on Twitter and Facebook at GCR2P.